There is abnormal permanent enlargement of the alveoli, number one, and number two is characterized by destruction of gas exchange air spaces, that is, respiratory bronchioles, alveolar ducts, and alveoli. There is no fibrosis in emphysema. Cigarette smoke produces chemicals that destroy lung tissue. Number two, smoke is chemotactic to neutrophils and macrophages. Number three is smoke also causes loss of cilia in the airway epithelium and predisposes to bacterial infection. Number four is smoke inactivates antitrypsin and antioxidants. What chemicals in the cigarette smoke destroy the lung tissue and how? Oxidants from cigarette smoke, pro-inflammatory cytokines, elastolytic proteinases, interleukin 8, TNF-alpha, and CD8 cells. So what do? They lead to neutrophil recruitment that in turn causes macrophage production of elastase. Inflammatory cell proteinases are the main substances that destroy lung parenchyma and subsequently cell anchoring, leading to apoptosis. What's the role of elastin and elastase in emphysema? Elastin is critical to the integrity of both the small airway and lung parenchyma. Increased elastase destroys elastin that decreases the elasticity and increases compliance, and loss of elastic recoil leads to airspace enlargement. All trans-retinoic acid can lead to some repair caused by damage with elastase. Why collapse occurs? Destruction of extracellular elastic tissue causes loss of radial traction, leading to collapse with obstruction, especially on expiration, preventing egress of air out of the respiratory unit, causing distension of the respiratory bronchiole. So the loss of elastic septa causes loss of radial traction that leads to collapse with obstruction, especially during expiration, prevents egress of air with time that causes distension of the bronchioles. So what are the effects on alveoli in emphysema? Number one, they are perforated to form larger spaces. Number two, alveoli are inflated but cannot deflate. Surfactant secreting clara cell replacement occurs, so that increases the surface tension. Surfactants decrease the surface tension by 2 to 10 times, which prevents alveolar collapse. Absence of surfactant increases surface tension and makes the alveoli more difficult to inflate after they deflate in expiration. When the alveoli they collapse in expiration, they need to inflate in inspiration, but because of the increased surface tension, they can't do that if surfactants are absent. This occurs when there is loss of clara cells. Number three, there is loss of elastic recoil. And number four, extracellular matrix destruction. So what does it cause? Loss of alveolar attachment. Because of loss of extracellular matrix leads to airway distortion and narrowing tendency to collapse with obstruction. There is decreased alveolar surface area for gas exchange. Why alveoli are overinflated? Alveoli are overinflated due to loss of elastic recoil due to loss of elastic septa. Because elastic septa are lost, so there is loss of elastic recoil. So they are inflated. What are the effects of loss of matrix? Number one, loss of elastic septa causes loss of elastic recoil. Number two, loss of matrix cell attachment leads to apoptosis of the structural cell of the lung. And number three, loss of extracellular matrix and cell leads to enlargement of the spaces. What are the cell types on bronchiolar lavage? Mononuclear cells and CD8 cells. More than 95% of the cells are macrophages and neutrophils in the bronchiolar lavage of the smoker. Mononuclear cells, what do they cause? Mononuclear cells in the respiratory bronchioles destroy elastic fibers in the bronchioles and alveolar duct. CD8 cells are also present in a smoker's lavage.